Hi, I'm Bridget Goslin, and today I'm going to be talking to you about preventing diabetic foot ulcers. What is a diabetic foot ulcer, you may ask? Diabetic foot ulcers are open sores or wounds that occur in the foot. They could be partial or full thickness skin loss. They occur below the ankle. 15 to 25% of diabetic patients will develop an ulcer in their lifetime, and 25% or 1 out of 4 patients will not have their ulcer heal. So, risk factors for developing a diabetic foot ulcer include visual impairment. If patients have trouble seeing, they may not know that they have an area on their foot that is either red, it could be swollen, it could be a cut, they just can't see it. Patients with retinopathy, which is a disorder that some diabetic patients may develop due to poor blood sugar control and also cause them visual impairment. Poor blood sugar control will also put you at more risk for developing these ulcers. Neuropathy, which is a decrease in sensation, especially in the feet, and limited mobility. Peripheral vascular disease, when there's a decrease in blood flow going to your lower legs, that can definitely put you at risk. If you wear shoes that are not fitting properly, if you have constant pressure, or injury. So injury could be something that breaks your skin like a cut. It could be a penetrating wound like stepping on a tack. Walking out barefoot, for example, going outside on a hot day and walking on the sidewalk or the blacktop in your driveway, that could be also an injury to the foot. Constant pressure in one spot, like with wearing a shoe, or repeated stress or infection. So common locations for diabetic foot ulcers could be at the top of the toes or on the bottom of the toes. It could be on the pad of your foot, the heel of the foot, and also in between your toes. Also, anywhere on your foot that is bony, meaning you feel your bone really easily, if that is being pressed against a shoe, that definitely can put you at risk for developing an ulcer in that area. So what are some complications of these diabetic foot ulcers? Infections, deformities, meaning that the shape of your foot can change, and amputation, having to remove part of your toe, your foot, or even your leg. So diabetes is the #1 disease that is associated with lower leg amputations in the United States. Patients that are likely to have amputations, so patients that are 45 years and older, they have an 8 more time chance of needing an amputation due to an ulcer. Patients who are 65 and older have a 12 times more likely chance. And patients that are 65 to 74 years are 23 times more likely to need an amputation. So as you can see, the older the patient gets, the higher their chances are of needing an amputation due to a foot ulcer. So how can we prevent these diabetic foot ulcers? And I have a little quote here from Benjamin Franklin: "An ounce of prevention is worth a pound of cure." So with prevention, we want to make sure that our blood sugar is adequately controlled, meaning we don't want our blood sugar to be too high, and we also don't want it to be too low. We want to try to keep it controlled at all times, and we're going to do that with diet, exercise, and medication. So we want to make sure that you're following your doctor or your healthcare provider's instructions on how often you should be checking your blood sugar. Some patients need to only check it twice a day, while some patients who may be on insulin have to check it more frequently. So your target range before eating should be your blood sugar between 90 and 120. And your target range after eating, it should be 120 to 180. With the diet, we want to make sure we're getting enough vegetables, our fruits, grains, protein, and non-fat and low-fat dairy. So your vegetables can be non-starchy or starchy vegetables. And we want to try to limit the starchy ones. I know those are probably the better ones, but we do want to make sure we're limiting your potatoes, your corn, and peas. And the non-starchy vegetables are going to be like your broccoli, your carrots, your peppers, and tomatoes. For fruits, we have your oranges, melons, berries, apples, bananas, grapes. Those are some examples. With grains, we want to make sure we're trying to get in whole wheat grains if possible. And examples of grains are going to be your wheat, rice, oats, and barley. And with protein, we want to make sure we're trying to get lean protein and trying to not eat so much of the high fat proteins. So we're looking at your chicken, your turkey, your fish, eggs, and even nuts. And with the dairy, we're looking for non-fat and low-fat milk, cheese, and yogurts. With exercise, it not only lowers our blood sugar, but also helps with lowering blood pressure. It helps improve blood flow. It burns extra calories so you can keep the weight down if needed. It helps improve your mood, and it may also help you sleep better. It is important to take your medications every day to prevent blood sugar from getting too high. So we want to make sure we're being compliant, meaning that we're following our prescriber's directions and we are taking them as we are told to. We want to make sure that we're eating, because if we take our medications without an adequate diet, it can cause us to have low blood sugar levels. So how are we also going to prevent the diabetic foot ulcers? We're going to do daily foot care. So we're going to wash and dry our feet daily. We're going to use warm, not hot water and soap. And we're going to rinse our feet very good. And then we're going to dry them thoroughly, especially in between the toes, because that's an area where moisture can get trapped. After we're done drying them, we're going to apply lotion. So we're going to moisturize the skin on our feet, but we're never going to apply the lotion in between our toes. Applying the lotion prevents our skin from getting cracked. And when your skin is cracked, it can let bacteria enter and it can cause an infection, and it can also cause an ulcer to form. We're going to inspect our feet daily. So we're going to look for cuts, red spots, warm areas, calluses, which is hardened skin, ingrown toenails, changes in color, or anything that doesn't look normal from your actual from your feet, like what you notice, any kind of change. We're going to make sure we're wearing proper fitted shoes. We don't want to wear shoes that are too tight, shoes that expose our toes, because that's an area that can easily get injured. And we're going to make sure we never go barefoot, especially outside. So even in the house, it's good to wear shoes or even slippers, something that's going to protect your foot. We're also going to trim our toenails very carefully. We're not going to use nail clippers or cuticle cutters. We're going to use an emery board, which is soft, and we're going to file the nail straight across. And we're not going to round the corners because that can cause ingrown toenails. So this is just a little picture showing some proper footwear. It looks like there's a couple pairs of high heel shoes, and the patient picked out the sneakers, which will not put pressure on the ball of the foot by going down into a high heel. So now we're going to split into groups. You can even do this just by yourself, but we're going to draw our foot on a piece of paper, and we're going to cut it out. Alright, so after you're done cutting out your foot outline, you're going to take your shoe, and you're going to take your insole that you just made, and you're going to put it into your shoe. Now, focus on, did it go in there easily? Did you have to kind of jam it in there? Because just think of how your foot is going into the shoe. So mine fit in pretty easily. But if you're wearing a smaller size shoe or a shoe that's too tight on the sides, you might notice that your little cutout doesn't fit easily. So this is just a reminder, we have to wear proper footwear. And as you can see, this protects the toes. It's closed in, and it has a hard sole. Next, we're going to practice doing self-foot examinations. This is something you need to do daily. If you're having trouble doing it to yourself, you can have a friend, family member, caregiver help you. They could either hold the mirror for you, or they can even look at the foot for you if you can't do it. So all you need for this is a handheld mirror. As you can see in the pictures, you can even get a mirror with a little stand on it, or even a mirror that's attached to like a pole, so you don't have to bend down if that is something that you have trouble with. So we're going to take our mirror and we're going to hold it down, and then where we can place our foot. So from here, I can now see the bottom of my foot easily. I can check for any cuts or sores, or any kind of, maybe there's a new growth, something that's different from if you're checking every day, you'll be able to tell that's something that shouldn't be there. I can even check in between my toes and even on the back of like my heel. Making sure that we control our blood sugar and that we're doing daily foot care is important so we can prevent diabetic foot ulcers from forming. If we can prevent the diabetic foot ulcers, then we decrease our risk of needing to get a lower leg amputation in the future. Now's the time. Now this part of our teaching session, I'm going to just leave open for any questions or comments anybody would like to share, or if we would like to go over how to check our feet again, we can do that as well.